we're going to do some glute and pelvic floor release with the Yamuna ball. I like to use the silver one for this part, but if you have the pearl one or a different size, you can try that as well. Let your fingertips come to the ground or place your hands on blocks to just bring the ground up to you a little bit. And then it's hard to see, but the leg closest to you is my right leg, and it's straight. And then I'm sitting right on the ball with my sit bone centered right at the center on top of the ball. And so I'll start by stacking my shoulders over my hips and then supporting myself on the ground. Take a few breaths. Let the pelvis sort of get heavy into the ball. And then slowly start to rock or roll the ball over the sit bone from the forward portion to the backward portion. Noticing if there's any kind of tension, you should be able to kind of feel the stretching of the fascia and the tissue away from that bone, just a tad. And so you go back and forth. You can come down slightly into the upper part of the hamstring and then to the sort of lower part of the glute. And do this several times, kind of feeling it out. And then come back to the center, and then we're going to do the same thing, but you're going to rock, instead you're going to rock side to side. So now the ball's coming to the outside of the sit bone, and then it's traveling to the inside of the sit bone, which is getting close to that pelvic floor. Make sure your tailbone is lifted so you're not on your tailbone. Stay neutral. Roll back and forth. And if it's too uncomfortable right on your pelvic floor, you can kind of skip that part or just get as close as you can comfortably. Otherwise, though, it could be a good release for some of that tissue in there too. So we'll do the same thing, maybe 10 or 15, 20 times in each direction. Then take your right ankle, and you might lean back a little more. Take your right ankle, place it on top of your left knee, and then lean to the right and do the same thing. So you're going to kind of find that tender point maybe in that side glute there, piriformis and glutes, and then roll forward and back and side to side. And as you feel like a tender point or you feel some tension, stay. Take nice deep breaths. Try to maintain that neutrality of your spine the best you can, just so you're not sinking in. But do try to relax as well, breathing. I like to stay onto the glute for about 1 minute to 3 minutes, up to you, depending on what you find. And then you can do the same thing on the other side.